Yes, thanks, Sid. Appreciate that. So we were talking about how a sore throat can lead to voice problems. So it starts off just as a mild inflammation, and then what we do with that, whether we're getting medical attention or not, or if you're overusing a voice, we can take it to a higher level and make it a voice disorder. So we'll talk about what we should be doing during those days a little later. Now let's go to another common condition that is due to smoking. Acid reflux can lead to this as well, but smoking is the primary condition related to Reinke's edema. So, this edema, which is basically a swelling, is seen right on the vocal folds. Notice that you can see a pearl white structure, which is the true section of the vocal fold, and then a balloon like structure around it. That is the swelling that gets in because of the heat of the smoke, the tar, the nicotine, and all those. I'm going to let it play, and let's hope that we don't uh, get into a technical snag again.
In slow motion, the movement comes out clearly. When driven upwards, they vibrate quite subtly, but irregularly. Glottal closure is never complete, hence the rather husky voice quality. Palpation under the microscope shows that the large Reinke's edema lies on the superior face of both vocal folds, and is indeed larger on the left.
Okay, so that was the voice condition due to smoking. Now, I want to play this video, especially if you have a son going through pubertal changes, or if any kid is watching here. This is how the voice box, the sound box of a pubertal stage boy would look like. Let's see.
Slow motion replay of the falsetto clearly shows how thin the free edge is in this register. And now, here is the deep voice found at the end of the consultation. Before. Before.
All right, so that is, we call it puberphonia, primarily puber referring to pubertal stage, phone referring to sound. So that's puberphonia. Now, how to prevent a voice problem or a disorder? As we all know, prevention is better than cure. I am going to play a video that is going to talk to you about healthy voice, your choice, basically vocal hygiene.
What is vocal hygiene? When it comes to vocal health, few people understand the importance that vocal hygiene should play in their daily lives. Simply put, vocal hygiene is a practice that you do to prevent misuse of your voice. The vocal folds, or vocal cords, are shaped like a V and held inside the larynx or the sound box by various different cartilages. They're made of different fibers and muscle that are used to create the sound that we need in order to speak. However, doing things that are unhealthy for the vocal folds, like lots of shouting or singing notes that are too high or too low for you, can damage these delicate structures. Thus, it's important to recognize what good and bad behaviors you're doing on a daily basis to help prevent damage to your voice. What are some bad things that you might be doing that can hurt your voice? Here are a few common things. First, don't smoke and avoid secondhand smoke. Cigarettes contain many chemicals that can irritate and dehydrate the vocal folds. Avoid excessive alcohol intake, drug abuse, and cough and cold medicine. All of these products dehydrate the vocal folds. Avoid clearing your throat as well as excessive throat clearing. Constantly coughing and clearing your throat causes the vocal folds to become irritated, which causes more mucus production. That means more throat clearing. Instead of throat clearing, try to take a sip of water or swallow harder. Don't yell or scream too often. Screaming and other harsh vocal behaviors put you at a greater risk for disorders like vocal nodules and polyps. If you need to raise your voice for a long period of time, take vocal breaks frequently and drink plenty of water. Don't laugh or cry aggressively. Over time, these behaviors can cause tension and damage to the vocal folds. Don't talk while exercising. When working out, the vocal folds press together harder due to more muscle use. Talking or yelling during exercise can cause the vocal folds to strain more than they should to produce sound. Avoid drinking caffeine. Caffeinated beverages dehydrate the vocal folds. Avoid whispering. Contrary to popular belief, whispering is not easier on the voice. In fact, prolonged whispering can cause strain over time. Don't eat highly acidic, spicy, fatty, or citrus foods. These could damage the larynx and prevent the vocal folds from closing properly. This includes chocolate, carbonated drinks, fried foods, mints, and alcohol. They can also cause reflux, which can irritate the vocal fold tissues and cause them to deteriorate over time. Don't ignore prolonged vocal symptoms. If you feel like you've been experiencing voice problems, such as hoarseness, vocal fatigue, or other symptoms, ask your doctor for a referral to an ENT. Now that we've talked about some of the bad things you can do to your voice, let's discuss some good things you can do. First, drink plenty of water. Hydration is important for voice production and vocal health. Use abdominal breathing with correct sitting and standing posture. This supports voice production by preventing vocal tension. Think of a car. It needs fuel to run properly, and all of the moving parts must be placed correctly. Breathing works the same way. Proper posture, the moving parts, must be in place, and the fuel, breathing, is needed to drive the system. Engage in regular physical exercise. It helps to improve breathing and promotes overall health. Do vocal warm-ups prior to speaking or singing, and use vocal cool-downs after to bring the voice back to a relaxed state. During these exercises, keep the shoulders, neck, and jaw relaxed to avoid muscle tension. Use a microphone for public speaking to keep your voice relaxed and at a comfortable level. This will help prevent the vocal folds from straining to achieve the loudness required for a given situation. Learn to recognize possible voice problems. Changes to vocal quality over a period of time, like chronic hoarseness, strain, breathiness, or other symptoms, should be recognized as abnormal and dealt with appropriately. Finally, get frequent voice checkups. It's common for people to go years with undiagnosed voice disorders. This can be done by an ENT or a speech pathologist, like here at Lamar University. As you can see, so many activities and behaviors we do every day can affect our vocal health, for better or for worse. So the next time you go to a football game or sing along to your favorite opera, keep this point in mind. Healthy voice, your voice!
Okay, that was vocal hygiene, which is the best way to prevent a voice disorder. Now we're going to look at treatment of voice disorders in general. Multidisciplinary approach is what we have to follow when it comes to voice treatment of voice disorders, because we're not just dealing with one aspect of voice. It's not just medical. It could be surgical, it could be due to gastro related issues, it could be neurological. So there will be several specialists who are involved. However, the primary professional team to treat voice disorders would be laryngologists, a specialist in medicine who is focusing on the larynx and voice related aspects. Speech language pathologists or vocologists, they work hand in hand with laryngologists, especially right from diagnostics to treatment approaches and then to study the prognosis of their patients. If the subject or the client or your patient is a singer, then involving a singing voice specialist who not only knows about the singing world, but also understands the speech and voice aspects would be critical, because if the singer is going off for training under a person who does not understand voice but knows singing, then there is a chance that he or she may not know what this person is going through. Voice therapy, we're going to talk more about voice therapy. It is a behavioral approach. It's not something that you go through medication and then say, yes, your voice is back to normal. But we deal with exercises that will help in improving voice or enhancing voice aspects. These are evidence-based approaches where these techniques are well researched and published in medical and health-related journals. The focus is not just on sound, but the entire system and subsystems involved in voice production, such as breathing, sound production, resonance, articulation of sound, speech sounds, and then projecting the sound and voice together. The exercises are related to relaxation of the entire system that produces voice, coordinating the system or coordinating sound between these systems that I said, breathing, voicing, resonance, and all those. And then the exercises also focus on endurance of sound production and the strength. Endurance and strength, these are the two primary ones that patients will come in asking for. However, we start or we reach that stage only after relaxing them and then coordinating all the other aspects. Sometimes patients need retraining right from breathing. They might not be breathing right, like breathing from the chest or shoulders and not using a good breath support. So retraining their breathing aspects would also be required. Voice therapy is a patient centered approach, which means we keep the patient in mind and accordingly change our approaches based on what their profession is, their voice needs during their daily living. We will have to modify our approaches. Voice therapy is not a quick fix. And for this, client or patient's cooperation is mandatory. Without their cooperation or their compliance to therapy, we will not be able to see a change or improvement in their voice. Practice makes perfect, so the patients will have to go back home. We see them like once or twice a week. The rest of it is in their hands. We will give them a home training program, and they will have to practice all the exercises given, and that is what will make their voice perfect. The sessions are customized, as I mentioned, based on the client's needs, based on their prior training, and based on their vocal demands. Our sessions will change and exercises will change. The length of a training period may vary. Some patients respond quicker, some are a little slower. It just depends on who we are dealing with. And based on that, our sessions can change in terms of number. Now, here is a task for you. We're going to talk about speaking voice first, and I'm going to give you around 10 statements. What I want you to do is look at that statement and then rate yourself as on a scale of 0 to 4, where 0 never, 1 is almost never, 2 is sometimes, 3 almost always, and 4 always. Now just put those numbers and keep adding as we keep going, and we'll talk about it. Right? Your first statement would be, my voice makes it difficult for people to hear me. You would put 0 if it is never, 1 for almost never, 2 sometimes, 3 almost, 3 almost always, and 4 always. Okay. Now the next statement, people have difficulty understanding me in a noisy room. Again, rate yourself. Keep these ratings in a sheet of paper because I'm going to ask you to add all these numbers together. Third statement, my voice difficulties restrict my personal and social life. 0 never, to 4, which is like always. I feel left out of conversation because of my voice. Give a number to that. My voice problems cost me to lose income. Okay, 0, 2, 4. I feel as though I have to strain to produce my voice. 0, never, 4, always. The clarity of my voice is unpredictable. My voice problem upsets me. People ask, what's wrong with your voice? 0, never, 4, always. So that should be 10 statements there. Add up those numbers. And if your number is 10 or above, then you do have a voice problem or a disorder. Anything above 6, I would say, is leading towards a voice problem and disorder. But let's give benefit of doubt and say 10. Maximum would be 40. So anything about 10, we can classify you as having a voice disorder. And this is about speaking voice. Now, we have a similar questionnaire for singers. So if you're a singer, go ahead and rate, oopsie, yes, go ahead and rate. Oh, I think this is the 10th one. So people ask, what's wrong with your voice? Did I ask that already? Okay, now for self-perception of singing voice. It takes a lot of effort to sing. First one, give a number for that. 0, never, 4, always. 2, I'm unsure of what will come out when I sing. 3, my voice gives out on me while I'm singing. 4, my singing voice upsets me. 5, I have no confidence in my singing voice. So all these rate on a scale of 0, never, 1, almost never, 2, sometimes, 3, almost always, 4, always. 5 more coming up. I have trouble making my voice do what I want it to. 7, I have to push it to produce my voice when singing. 8, my singing voice tires easily. 9, I feel something is missing in my life because of my inability to sing. 10, I'm unable to use my high voice. Again, rate all these on a scale of 0 to 4, 0 never, 4 always. Add up all these numbers. Again, anything above 5, I would say, let's call 10 again. So if you are at number 10, then you do have voice issues related to singing, and it would be time to see your voice care team. Questions. Now, type your questions in the comments window. I will pull up my chat window here, and we can talk about what questions you have, and I'll be glad to answer your questions. Right, Saravanan Kaliyaperumal has asked, what types of functional anatomical changes, if any, happens in professional mimicry artists in their effort to sound like someone? Now, this one can vary from anything from vocal nodules, where you would just see a mild bump on the vocal fold, to a condition called vocal polyps. I'm going to bring that video up and show a video on vocal polyps. And right there. Okay, let's put this up. Let me show you vocal polyps and how it looks like. So right there, while you're watching, it's going to be, oh, I hope it plays now. There we go.
On phonation, the polyp makes the right vocal fold rigid, vibrating only in its posterior third.
So what you're seeing there is a red blister, blood-filled blister on the vocal fold. That's again because of these excessive overuse or misuse of voice. That is one of the conditions that could lead to, but it can be anything from a mild bump on the vocal fold to something as major as this. All right. Does hypothyroidism affect the voice? Yes, any hormone related issues related to voice can lead to voice problems. Now, sometimes just medication can affect as well. So you will have to check with your physician if that medication is a vasodilator or if it's going to lead to dehydration. All those can lead to a change in voice because dehydration can make the larynx pump more phlegm just to increase the hydration levels, and that can affect voice. And vasodilator will pump up the blood vessels around the vocal folds, and voicing with that on the vocal fold is risky. I'm finding hard to sing in high pitch during winter season. Is there anything that I could do? First, we have to find why is winter season bothering you? Is it allergies or is it the cold weather that's affecting? Or so we'll have to find the root cause during that particular season. Now, first thing to do is, as I said, to find the reason for that problem. And then I'm assuming you're a trained singer here. So, with that in mind, you will have to work on your pitch range after finding the cause for that problem, and then work on either medication or healthy vocal fold vibrations through a vocalogist or a voice therapist. My recommendation would be not to just dare and go all the way high in pitch because that might affect your vocal folds. At the same time, I will not recommend complete silence of voice. A complete voice rest is also not healthy. So, engaging your voice in a healthy fashion is what I would recommend. Sid, can the vocal folds naturally repair themselves if affected? I wish it did. If it did, I wouldn't be having a profession here. Well, jokes apart, if your voice is just mildly affected, let's say by these cold kind of symptoms, then yes, if you did not overuse it during that time when the virus just dissipates in its action, the bacteria resolves. So our recovery after common cold and all those, getting back to a natural voice, is what we naturally what we call as natural repair. Now, if you have overused your voice, the voice rest that you give, that will naturally repair. Yes, coming to your statement, naturally repair. The vocal folds have a substance called hyaluronic acid. The hyaluronic acid are basically like conditioners. They, when the vocal folds have been overused, they swell up, and then when you're taking a voice nap or a vocal rest period, the hyaluronic acid goes in and massages these tissues, conditions these tissues, and brings them back to its natural state. So, to some extent, yes, there is a natural repair going on. But if they have a polyp, nodule, or any disorder, then the vocal folds do not. You will need medical help, which includes may include surgery and definitely voice therapy. Any other questions? All right, maybe related or unrelated. Why is that stutterers or stammering persons do not have trouble to sing, but have trouble with speech? It's related to. All right, this is not related to how the sound box is functioning, but let me just go ahead and answer. Stuttering, even though it's not my specialty, I'm going to give my 2 cents. There is a disfluency when it comes to the rate of speech and the typical function of communicating. All those give in their 2 cents in bringing the fluent speech to be disfluent. But when it comes to singing, there is a melody there, and it is relatively slower than speech. Even in fast singing, when you're trying to match the melody, that's one reason why stutterers may have disfluent speech but have absolutely fluent singing. I hope I answered that. How do we know when we are working our vocal folds outside? Okay, how do we know when it's not our optimal range? The voice, as I said, has a specific vibratory range based on the length, mass, density, and and the tension levels that we put to produce voice. Sometimes we tend to over react with what we hear. We like somebody's voice, we try to match them. Now, a good way to see where your voice sounds is that um, think about a question like, is the door open or is it Friday today? We give a that should be your optimal pitch level. So now that I made you conscious, you may try to go too low or too high, but at a spontaneous response, the response is where your comfortable pitch is. That's one way to identify. Two, go to your low pitch and glide all the way up, like. So let's say that's your pitch range, and let me give an analogy here. If that's your floor or your ground floor to the highest floor, so floor one in the US is ground floor, in India it's different. So from ground floor to the top floor that you have, if that's your pitch range, your comfortable pitch range or modal pitch range will be somewhere at the third to fifth floor. So let's say around fourth floor. So the reason why we have to stay at that fourth, fifth floor is that speech, as we know, is not a monotone. You don't just stick to one pitch. We talk, we get higher, we get lower, depending on how we talk. So you need to go down and go up. So staying at that fourth floor gives you a good lower range and a good higher range. If you're stuck down too low, somewhere at the first floor, then your lower range will be affected because you'll be forced to go to the basement. And when I say basement, I mean that vocal fry, where your voice sounds raspy. For some reason, this voice is becoming more popular, especially in college kids. They keep that voice at a vocal fry. That's not an appropriate voice. That can lead to a voice disorder in future. So trying to glide from a low to highest pitch and then pick somewhere at that third to fourth, fifth note, that would be your optimal pitch. And the other ways to find is to sit with a voice specialist, and then they would record your voice, and then we can identify where your range is. I hope I answered that, Sid. Oh, thank you, Mala Gopal. Appreciate your compliment. How do I combat too much saliva production? Yes, that is a very common condition, and there are myths related to that. Some people just suck on lemon to dry up their oral cavity. Some take mint candies. I would recommend not to do any of these. The best way to combat having too much saliva in mouth is to stay hydrated, which means keep drinking or sipping water. Now, that hydration will, saliva production sometimes, whenever we get too dry or when the body is dehydrating, our body naturally tries to combat that by putting more saliva. So, frequent sipping of water, and when I say water, let it just be water. Anything in that water, including tea, coffee, or ice cubes in your drinks, juice, and all those, that can affect hydration. So water is just plain natural juice that nature has given us. So sipping water frequently, especially before singing, will hydrate you and avoid any dehydration. Warm water, hot water, I would say, depending your experience, try both. Sometimes cold water acts as a soothing effect, and traditionally, warm water is also preferred, especially if you're having a lot of mucus. So if you have a lot of phlegm and mucus in your throat, warm water will help melt it. As you swallow, the phlegm goes down. So I would say it is just it varies subjectively. So try both, once cold, once hot or warm, and pick the one that works for you best. Thank you very much, Ms. Dayalini. Appreciate that. Any other questions? Thank you very much. Let me pull up my slide, and I'll have to thank my sponsors here. So right there and there. Right. Okay. Any other questions? How to start my practice in the morning without struggling? Great question. That's a very common issue that many singers are facing. So I'm going to touch upon a few aspects. It also depends on what you ate the previous night. If you have acid reflux, your morning voice is going to be poor. So that's a good sign. Usually, if you have muscle tension or if you have been teaching a lot, singing a lot, you take good 8 hours of a nap at night, and when you wake up in the morning, your voice would sound fresh. If it is not fresh, or if it is not easy, that means throughout that night your voice has been, or your vocal folds have been struggling, and that could be because of acids that come out at night and attack your vocal folds. So if your voice is not strong in the morning, I would recommend being tested for acid reflux, and which means avoiding any acidic food before going to bed, and also giving enough time for your food to be digested before you go to bed. A good 2 hour before your last meal and bedtime is suggested. Again, if you have acid reflux, trying to elevate your bed or putting a couple of pillows and keeping the acids down. And anecdotally, lying on your left side also helps, for the reason that when you're on the left side, the stomach is in a different position. And when you move to your right, it's in a position where it's ready to empty the contents. So that might help, and please let me know if that worked. And when if you get tested for acid reflux, let me know if my hypothesis was right. Thank you, Vijay Chandra. Appreciate that. You're welcome. Any other questions? And I plan to make a similar series of lectures about vocal health, giving tips. Feel free to subscribe to this channel so that anytime I upload something related to voice, it pops up on your window. And I should alert you, this TV, INEA TV, is an infotainment channel. It has multiple programs. You will find health-related topics, cuisine, cooking, recipes, local events, interviews of celebrities. So one of the playlists will be related to health, and this is a good start for voice, and I'll continue to add more as we go down the road. Any other questions? Great. Thank you very much for attending this lecture. Oh, yes. Could you please do some more videos, especially for singers? Absolutely. That is part of the plan. And I will give out some tips. And some of the exercises, I should alert you, if you're watching YouTube to learn vocal exercises, there are a lot of quacks out there. I shouldn't blame them, but I can confidently say that because being an educated professional in this field, I have noticed that some of the techniques demonstrated there, they may have the right term, they may have the right name, but the demonstration is not right. So take it with a pinch of salt, consult your voice specialist before you try to practice anything that's out there. So watch out who's presenting it, and that should be enough to see if it is authentic or not. Um, okay, so yes, to answer your question, I will definitely upload in future. And we have another tip from another speech language pathologist, Dr. Selvi Papangatu Senyapan, who happens to be my wife. You can tell by someone who's interrupting while I talk, right? Just kidding. So if there are no other questions, we'll wind up our first lecture. Unfortunately, had to do this as two parts. I don't know why the system crashed. Maybe I'll try to keep my lectures 30 minutes. Maybe it was like an overload or whatever the reasons are. So I will keep you all posted about the next lecture. And as I mentioned, see if you can subscribe to this channel so that you get notified as and when we put a video. Thank you very much once again. Let's call it a day. Have a good day, good evening, good afternoon, whatever part of the world you are in. Thanks for tuning in from, I can tell, from Australia, from Singapore, Malaysia, and different parts of the United States. In spite of that, it was very good. Okay, great. I will let Dr. Selvi finish her comments, and then I can stop the streaming. And if you all need immediate advice, here's my email address. Feel free to reach me out there. mar.edu. This is my official email. It goes to my office mailbox, which I definitely check every day. So feel free to get in touch with me, and I'll be glad to give my 2 cents. Okay. Good night, good day, good evening, good afternoon, good morning. I am going to end the stream here.